Good afternoon, everyone, and thank you for joining us today. I hope you've had a safe and happy Family Day weekend. We'd like to once again welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. And today, Hamilton enters the red control category of the province's reopening framework. So moving into this red category is good news for our business community. Restaurants can open with a capacity of 10 patrons seated indoors with a limit of 4 people per table, with face coverings, which are still required except when you're eating or drinking. Retail establishments can also reopen with capacity limits and health screening, 75% capacity for supermarkets and other stores that primarily sell groceries or convenience stores, pharmacies, 50% for all other retail, including discount and big box retailers, liquor stores, hardware stores, and garden centers. As well, sports and recreational facilities may reopen with capacity limits as well, and personal care services may also open. So visit hamilton.ca/coronavirus to learn more about the reopenings and current restrictions in our community while we're in the red control category. I'm also pleased residents are now able to access most city services in person with an appointment. I want to stress that it's by appointment only, so you can call 905-546-CITY-2489. Many of our services are available online, and residents are still encouraged to access these virtually where possible. So visit hamilton.ca/online city services. The first due date for property tax installments for 2021 is coming up, so there are many options for residents to pay your property taxes that don't involve coming in person. You have pre-authorized debit payment plans. You can pay at the bank. You can pay by mail, by telephone or online banking, or in person at City Hall or a municipal service center. But again, remember, by appointment only. You can't just walk in the door and get service at these desks. So you need to make an appointment. Call 546-CITY or 2489, and you can make an appointment to come and pay your taxes at a service center. There are a number of other reopenings happening for cities' facilities and services and programs, and Paul will walk you through those in just a moment. And so while we are no longer under the stay-at-home order, we must continue to follow all public health safety measures in order to protect the health and well-being of everyone in our community. We must make sure that we don't get complacent when we see our case numbers go down and our economy slowly reopens. We are still in a crisis, and it's a deadly virus in our community. And there's also continuing concern about the variants that may be out there that I'm sure Dr. Elizabeth will tell you about. So do not let our collective hard work go in vain. Please continue to follow the health and safety measures, which includes masking, physical distancing, all the things that we've been doing, including staying within your own household as much as you can. That's preventative and certainly will protect you from contracting the virus as much as humanly possible. I'll now pass it on to our Emergency Operations Center Director, Paul Johnson. Paul?
Thank you very much, Mr. Mayor. And it is great on one hand to see more activities available, and I'll get to that, particularly in the case of our recreation programming at the city and sports and recreational facilities in general. It's a really important piece of keeping healthy in other ways. But the messages you're going to hear today are pretty consistent from the three of us, and that is that we have to be very vigilant and protective of our own safety, and therefore by doing that, the safety of others around us during this period of time. I can tell you that the conversation at the Emergency Operations Center was one of nervousness. And generally we have, as we've closed and reopened a number of times over the last 11 months now, we've generally been, okay, here we go. We understand clearly why, and it's been just operationalized. On this one, we're obviously operationalizing it. We are in the red control category, but there's a little sense of nervousness because we're unclear about these new variants that are coming along and their impact on the community. And when we listen to Dr. Richardson and get her advice, I think you'll hear the same kind of sense from her as well. But we do push forward. So that is a preamble to say, be safe, follow the measures. When you go out and you access these facilities that are now available to you, be they businesses or organizations, do so in the safest manner possible. Wash your hands regularly, wear your mask, and wear it at all times that you possibly can. look for as few times as possible to take your mask off. And I know in restaurants, that's obviously when you're eating or drinking. But while you're just talking at the table, when you're walking into the facility, it's not a mask-free zone for the entire time you're there, and that will help us as well. It's those types of things we can do together that will help us get through this period as well as we can. So the mayor took you through a number of the pieces that are opening up. All of the information's on our website, the provincial website as well, so people can find out all of the activities that are going on in the community and the limits that are placed around those. In terms of the city, one of our major focus areas will be around recreation, because as I mentioned, we are pleased that in some small ways we can get people back into additional activities that will help keep them active and help keep them healthy. And so things like winter golf will become available again at the Shadoke Golf Course. Disc golf and disc lending will be available at Kings Forest. We are going to slowly bring our indoor arenas back online, and ice rental will be available for groups. It's still very limited in terms of the numbers of people who can be in there, but we were really pleased also, and a big thank you to the province for further clarifying the definition of facilities. So fully enclosed spaces in a multi-use facility, for instance, where we have 2 or 4 pads of ice, each area is where we will be enforcing the limits. And so in each of our rinks, if we have a double rink or in all 4 of the rinks of the quad pad, we'll be able to have 10 participants and then the coaches and a guardian if the people are under 18 years old. So those are some good things that will encourage safe extra participation. And that's a bit of a change. And we were very pleased that the province further clarified it. We'll also be getting and readying our indoor pools. There is a bit of work that we need to do on indoor pools whenever they go dormant for a long period of time, and they have been dormant since we went into the gray category before the holidays. We need to get those back up and going. Don't expect them online until the beginning of March, but we'll be ready for some pool openings through the month of March as well. Right now, all access to recreation programs are restricted to residents of the city of Hamilton and Hamilton-based organizations and sports clubs. And this is a piece that picks up on some comments that have been made provincially, and certainly things that we've talked about locally at our Emergency Operations Center, which is we want to ensure that the activities that are opening up because of the category we're in are with people that are in that category, and that we're not seeing people coming from the Greater Toronto area and quite frankly on the other end from Niagara, because they remain in the gray lockdown category, that they would be coming in utilizing services. We did see this in the last time that there was a variety of color schemes across the province, and so we're trying to do our best to keep that there. So for organizations and for obviously for families and individuals in the city of Hamilton, you have access to your recreation facilities, absolutely, but we will be curtailing access to others during this period of time. The mayor mentioned that appointment only services are available. Why appointment only right now? Again, we're getting back into this in easing into it. So in-person services we want to get back to, but we're doing it by appointment only. That will keep us from having lines of people outside. A, the weather's not great. B, again, just that safety measure of having those appointments, knowing who's coming, how many people will be there to keep everybody safe. From an outdoor recreational perspective, we have had a few questions about masks. And so I just want to be clear again that when it comes to outdoor skating rinks, playgrounds and play structures, toboggan hills and the escarpment stairs, we are asking residents to wear their masks or face coverings. It is not part of our bylaw. But we're asking it because those facilities, remain open because we can figure out ways to keep them safe if you wear masks. Because in most of those locations, if you're not the only person on them, and if you look at the stairs, oftentimes you'll pass people. You're passing within 2 meters of somebody. On playgrounds, you could be playing and obviously interacting with people in close proximity, and same on our hills. So from an enforcement perspective, it's going to be asking people to do so. We do so at the outdoor rinks, and we actually provide masks if people forget them or don't have them when they arrive. But we can't be all places at all times. And to the specific question, is it in the bylaw? It's not. But that doesn't mean we can't ask, and we do expect people in those 4 instances to be wearing masks. So this is a time to keep safe. This is a time where we will adjust our enforcement to the new rules and regulations that are in front of us. But as I was asked late last week, no change in our commitment. One of our top line commitments in our bylaw enforcement area is around COVID-19 and the safety protocols and the regulations that are in place. So businesses and individuals will continue to see our folks out enforcing where they can to the new regulations now that we're in the red control category. And I'll pass it over to Dr. Richardson.
Thanks very much, Paul. So going to go through some case updates today and then speak a little bit more about where we're heading with the red zone and some vaccine information. So 9,877 cases total in Hamilton as of today. That's 60 new cases increased from yesterday. 92% of those are resolved, down to 330 active cases and 276 deaths to date. Fortunately, no new deaths today. We are currently reporting a total of 18 outbreaks, with 2 new outbreaks reported today, one at Good Shepherd's Men's Centre and the other at the Hamilton Wentworth Detention Centre. So our numbers do continue to come down. Our 7-day moving average is at 35 and our weekly incidence per 100,000 at 41. And the province did update our weekly reproductive rate at 0.88. So as always, you can find out more about those details on our website. Just going to mention, as Paul and the Mayor did today, about us going into the red category under the provincial reopening framework. So as things begin to open, it is critical that everybody knows that there has been emergency provision put into place by the province where we could return to a higher level of restrictions, I should say, if there are increasing cases, and particularly if we begin to see a rising number of cases of the new variants. So that is something that is out there as a possibility, and speaks to the fact that we are in this situation where there are a number of concerns still about the level of cases and the potential for the new variants. And so it's absolutely vital that we continue to be cautious and vigilant, that we don't let our guard down. We continue to follow all of the public health measures, not gather with those outside of our immediate household, to stay home as much as possible, wear our mask, wash our hands, and absolutely, if you aren't feeling well at all, to stay home. And that is absolutely a critical element about this. We should still all be concerned with the variants appearing, and it's vital we stay on track around good public health measures. That's what's going to keep us safe. You'll notice in terms of the restrictions under the red zone, you may remember back in December that there were additional restrictions that I put in place at that point in time. If you look on our website later today or so, you will find a letter that contains the amended screening requirements, safety plan requirements, physical distancing and capacity limit restrictions for businesses and organizations under the ROA. So through this letter, I'm advising the public and the businesses that the provisions from that December 4th letter are no longer in effect and the new requirements will take over. Essentially, all of the critical elements from those directions were taken up by the province and incorporated into the regulations. And so there's no longer a need for those added requirements. So that letter and the new requirements can be found at www.hamilton.ca/public places in that section of the website. On the vaccine front, I'm glad to be able to share some good news on that topic. So as of the end of the day yesterday, we had completed a total of 25,600 vaccine doses almost, with 8,300 of those through the mobile site and 17,200 through the fixed site clinics. And over the weekend, the provincial government announced the expansion of the COVID-19 vaccine program, given the expected gradual increase in Ontario's vaccine supply, and it is going to be a gradual increase right now. The next target groups within the phase 1 priority populations have been identified for vaccination. So we continue to wrap up our immediate priority for first dose vaccination. So that's the staff and essential caregivers in long-term care homes, high-risk retirement homes, First Nations elder care homes, and anybody who had missed their first dose in those settings, we are making sure to catch them up as well. We are vaccinating our ALC patients in hospitals who have a confirmed admission to a long-term care home, retirement home, or other congregate care home for seniors. As well, in that first priority group are the highest priority and very high priority healthcare workers. And the ministry has enunciated a very detailed prioritization framework for our healthcare workers. And of course, the Indigenous adults who are in northern, remote, and high-risk communities, including both those on reserve and those in urban communities. The next priority for first dose vaccination, once all reasonable steps have been taken to complete the first dose of vaccination for all of those groups, We'll then be moving on to vaccinate adults who are 80 years and older, staff, residents, and caregivers in retirement homes and other congregate settings for seniors. So just going to pause there for a moment. We did, based on the earlier supply pieces, we have already begun retirement homes here. And just to note, a congregate care setting for seniors is not a senior's apartment or that sort of a facility. It's really a facility where people are eating together in a formal dining room and that sort of facility. Healthcare workers in the high priority level are within that next phase in phase 1, and all Indigenous adults and adult recipients of chronic home care. So there will be some more details about the adult recipients of chronic home care, but certainly the expectation is that early in March, we'll be able to start reaching out to this next phase of people, particularly those who are over 80. So we will continue in our mobile clinic with second doses in long-term care homes, high-risk retirement homes, as well as our first doses in retirement homes, the satellite health facility at St. Peter's, our ALC patients who are waiting for a spot. And that did continue through this past weekend and will continue next weekend. We just had a very slight one-day pause because of the weather when everybody couldn't get out to the clinics, when there was not enough people that could get out to continue on. So we do plan to wrap those up by the end of the weekend. And the HHS fixed site clinic is continuing to provide second doses to staff of long-term care and high-risk retirement homes, essential caregivers, high-risk healthcare workers. They did resume on the 10th and then paused after the 14th while they waited for some more supply, and they'll resume again on Friday of this week. And based on the projections we have of when our doses will arrive, we do anticipate that the timelines of being vaccinated within that 42-day window will be met. So good news in terms of moving it forward. As I said, it's going to continue to be a gradual rollout of the plan. We're going to have more information about the plan at the Board of Health meeting this week. So stay tuned as we continue to paint in the detail in the overall plan as well. Back to you, Mr. Mayor.
Thank you, Doctor. Thank you, Paul Johnson. And while today many businesses are reopening, I want to remind everyone to be patient and kind to those that are working in those establishments. Local businesses are doing their part, are required to do their part to reduce the spread of COVID-19. So when they're asking you to wear a mask or to answer some questions around health screening, or to keep your distance from other customers and other individuals in our community, they're doing what they're required to do. And trust me, they're as nervous about COVID-19 as everyone else is, maybe even more so, because they're interacting with a lot more people than the average person in our broader community. So be kind, be respectful, do as you're asked to do when you're entering these establishments, and help our essential workers and grocery store clerks and frontline healthcare workers do the work that they need to do, and hopefully de-stress their work as well a little bit. That's what you can help with. We are all in this together, and together we need to help one another through this. If you know of someone who is struggling with the pandemic, please reach out for help. Call COAST at 905-972-8338, or you can call the Kids Helpline at 1-800-668-6868. You can also visit our website, which has a number of agencies and partner organizations who can help individuals. So hamilton.ca/COVID mental health. All of those will give you opportunities if you're struggling in our community with the pandemic or any other health-related mental health issues. Please do reach out for help and assistance. It could help you manage your time through this difficult and awkward time. So don't give up. Everyone keep doing what you're being asked to do. It is exceptionally important that we remain vigilant on some of these health measures that we're asking you to do, because this is a critical time. I'm going to turn it back over to Jasmine now for some additional questions from our media partners. So Jasmine.
Great, thank you, Mr. Mayor. We do have 6 media on the line today. We'll start with 1 question and 1 follow-up for everybody. First question will be to Kate McCullough from the Hamilton Spectator. Kate, you can go ahead.
Hi, everyone. Thanks very much for taking my questions today. My first question is for Dr. Richardson. Dr. Richardson, I wonder if you could tell us about asymptomatic testing in schools over the weekend, in terms of how this initial or pilot testing went, what uptake was like among students and staff, how many tests were conducted, and anything you can share about the results?
Hi, Kate. Sure, absolutely. In terms of the asymptomatic testing, just a reminder that there were 4 schools overall that participated in Saturday's pilot. They tested 21 eligible staff and 65 eligible students over the 7-hour clinic that went on there. I'm sure the weather had a little bit to do with the uptake in testing at that point, but we were able to see people, get them through. Of those that came forward, there were no positive test results, so there were 0 presumptive positive cases. So with numbers coming down, we do know that what happens in schools reflects what's happening in the community. The fact that we had no cases means it's great that people who are going out to get tested, because you'll remember that these came from areas that had lower access to testing, but had higher rates of illness and had outbreaks in the schools. So it looks like the right people are going to get tested at the right time. It absolutely does not mean that people in these areas should let their guards down. And we're going to continue to work with the schools around the recommended measures around daily screening, all the things that they need to do, the physical distancing, the masks, all of those things while they're there in the schools.
Thanks very much. And my next question is related to something that you mentioned. I just wonder, how valuable is asymptomatic testing in schools, either in terms of preventing transmission or in terms of data collection, if uptake is relatively low, or it seems like it was relatively low in the first in the pilot?
Well, there's a lot of questions around asymptomatic testing. In general, we use asymptomatic testing. We think about it in cancer screening and those sorts of things, like pap testing and those kind of things. We don't generally look at it in infectious diseases in this way. And so these tests in particular, they have some challenges when it comes to using them. Because they're not the ideal screening tests as we go forward. That's why it's so important that if anybody has any symptoms whatsoever, that they do go for testing through the assessment centers where they have the gold standards for testing available to them. So I think, where we looked at it was to see, would we get more of a turnout in areas that weren't able to access tests. We do also have testing pilots that are going out from other parts of the system with our paramedics, looking at testing to improve access to testing in areas that have lower rates of testing, but higher rates of disease where they're having challenges with access. And so I think that may well turn out to be a method that works for us really well. But we're still going to continue to look at it. What might there be circumstances where it is helpful? Perhaps, but by and large, what we're seeing here in terms of the results, it's the good news is we didn't end up with a lot of false positives with a lot of kids that needed to be excluded from school and their families.
Thanks, Dr. Richardson. Next question will be to Lisa Pulaski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my question. This is for Dr. Richardson. Just wondering, you've mentioned the emergency break provision that the province has for local medical officers of health if, cases do increase or if you see cases of the variant. Do you have specifics on the thresholds that you would basically, at which point you would put that emergency break kind of into effect? Would you have to see just one case of the variant, or would you have to see a certain weekly case rate? Just wondering about the specifics of that.
Thanks, Lisa. The specifics of this are still being worked out. So it's something that the Chief Medical Officer of Health for the province, David Williams, would look at in conjunction with the local medical officer or medical officers of health, depending on the size of the region that's affected. It wouldn't be a single case of the variant that would do that. We know we've had cases in multiple jurisdictions across Ontario, and most of those are back into the prioritization framework at this point, but it would certainly be something if numbers started to rise that we would look at. So those details are still being worked out at the provincial level, but we're very glad it's there in case we start to see those kinds of increases.
Okay, thanks. And my next question is for you as well. Just wondering, there was a little bit of a data discrepancy over the weekend in terms of, I guess it was Sunday, I think, where it said negative 21 new cases, which is an unusual thing to see. Just wondering if you could comment on how that happened and why that was a number on the weekend.
Yeah, thanks, Lisa. Day by day data numbers are a challenge. And so, what happens is that the information comes in from the labs and through the Ontario Lab Information System. And then our staff work very hard to reconcile the two different data sources. And depending on the timing of when things come in and when things get reconciled, you can see those ups and downs as we go. And so that's why it's really important not just to focus on the day by day numbers, but to rather look at the broader trends of what is happening. And so, we can see right now the trend is generally coming down, but we've had a couple of days with higher numbers and one with a very odd negative number. And so, but the general trend is still that is the thing that we need to look at as we're looking at the cases.
Great, thank you, Dr. Richardson. Next question will be to Vyosa from the Hamilton Spectator. So hopefully I've pronounced your name correctly, Vyosa, and you can go ahead. And we'll just get you off mute there if possible.
Thanks, Jasmine. Yeah, that was the correct pronunciation. And thank you for taking my questions. My first question is for Dr. Richardson. So currently under Section 22 orders under the Health Protection and Promotion Act in Hamilton, it seems to only be in place for congregate living settings in relation to the pandemic, but other health regions have used that as a mechanism for workplaces and businesses where one or more people have been diagnosed with COVID. As you mentioned, you're still waiting for word on what criteria will be in place for the emergency brake provision. And while you wait for that criteria, do the Section 22 orders give public health enough of a mechanism to put out fires if the region were to see higher spread in the coming days?
Thanks very much, Vyosa, and welcome to our conferences. In terms of the Section 22 orders, so yes, we've used them here in Hamilton in relation to congregate care settings of various types. And essentially what we need to do in order to use the Section 22 orders, we have to be clear that there's an outbreak going on, which this pandemic clearly is. And we need to be sure that what we're ordering somebody to do is what's needed in order to make the change. And so most often, most businesses and organizations, when we're working with them, they are able to put into place the changes that need to be made. And we're able to work through with education and those sorts of approaches in terms of making a difference. So the Section 22 orders are generally reserved where we see a problem, an ongoing problem where that isn't happening. And so we haven't had that in relation to our workplaces here in Hamilton. Indeed, we didn't have any workplace outbreaks until this second wave really here. So they are available to us if we need them while this emergency brake provision gets worked out, and we would use them if we felt those needed to be implemented. But ideally, we would get to this framework that we're using consistently across the province. So that there's similar mechanisms that happen across the whole province. And indeed, as we go forward, we may well find it's multiple jurisdictions that need to have that applied. And so again, you'd want to have a consistent way of doing that across those jurisdictions.
Awesome. And my follow-up is also for you. I'm wondering if you could tell us if cell phone mobility data will be used to track so-called region hopping for those attempting to access businesses in Hamilton for shopping, for example, and what do you expect to see based on pre-lockdown trends versus like how this time could be different?
Well, that's a very good question. We don't actually have the cell phone mobility data right now. We had some access through a demonstration that was given for us, and the province certainly has that kind of mobility data that they are using when you see the analyses that are done by the science table. So we're hopeful we may have some of that data in the next couple of months, but we don't have it at this point. In terms of what we expect to see happen, I think that's the whole question for all of us is, how much are we going to step backwards? How much are we going to learn and go forwards in terms of mobility and these sorts of things? And so definitely my colleagues around the province are quite concerned about mobility issues. And so you'll have seen out on the eastern side of Toronto where a Section 22 order was issued there. In terms of prohibiting people from booking into various settings there. I know when you look at Niagara, where they have had some access to that data, they've seen a lot of challenges around shopping and movement into their area, and a lot of in their case management, they can actually tie back several of their cases. So It's certainly something we're concerned about. As Paul said earlier, we don't want to see people moving from one area that's under a stricter level of controls because they have more disease. We don't want to see them coming out and booking into our facilities, into our premises. So we're really encouraging people, again, through education, not to do those sorts of things. We know from the last phase that if that's what happens, it will spread, and we'll have to take a step backwards. We're in a time where we really need to continue to maintain public health measures. The vaccination program is rolling out, but it's not robust enough yet in terms of the access to the vaccine in order for it to be effective in reducing spread.
Great, thank you, Dr. Richardson. Next question will be to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks, Jasmine. Thanks for taking my question. My question is for Dr. Richardson. I'm wondering, the message from the Ontario's Chief Medical Officer of Health continues to be for people to stay at home as much as possible. Yet this return to the framework begins a reopening of the economy, allowing people to go out again. Do you think this mixed messaging will make it harder for Hamiltonians to understand how they should behave now?
Yeah, Matt, it's a good question in terms of, are we clear in terms of what the concerns are and what this means? I mean, there's a strong desire for people to be able to, earn their living, to be able to support themselves, for businesses to be able to do what they do. But we have to continue to consider it within the context of the advice to stay at home. And so it's not, let's go out shopping, let's go do these things, let's gather with our friends at the mall, let's, go out for dinner with a group of friends. It's very much a matter of there is some reopening so you can access those things, but as much as possible, you should be able to stay at home and make sure you're following public health measures overall. And if we don't, we've seen what can happen in the past when that didn't happen. Our case rates went up. We had more outbreaks than ever in our congregate settings and in our most vulnerable populations, and our hospitalizations, ICU use. All of those things went up. And so, I'm hoping that people see what happens when it goes too far on that front, and take a more somber approach as they move forward.
Thanks so much. I have a follow-up for you as well. Last week, you expressed some unease with the return of the framework, said it seemed a little quick. I'm wondering, now that we know how it all shook out, how do you feel about us being in the red zone? Do you think that's the right place for Hamilton? Do you think we're ready for this?
I think when it comes to this, ultimately we're in that place. There's that balancing between the economic realities and the health pieces. And so, there was going to be a step forward in terms of reopening to some extent with access to retail and those sorts of things. And there's not a huge difference between gray and red, but I'm still quite concerned. And I would say we still need to be very cautious, just as I was saying about moving forward. The new variants in particular are going to be an issue for us. And we have to remember, the more cases that we have out there, the more chance there is for other new variants to emerge. And so definitely hoping that people really are hearing that there is a strong message about the need to continue to follow public health measures. There's strong reasons for it, and that ultimately people will make the decision to do so.
Thank you very much.
Next question will be to Desmond from CBC Hamilton. Desmond, you can go ahead. And we'll just get you off mute if you'd like to ask a question, Desmond. Okay, we'll move on. Next question then to Nicole Martin from CHCH. Nicole, you can go ahead.
Thank you so much for taking my questions. Sorry, Mayor. Sorry, Paul. These questions are for Dr. Richardson as well. Dr. Richardson, the province tells us that they expect priority groups of seniors 80 and older will be the next to get the vaccine, as you mentioned, and that they say that neighborhood mobile clinics are being planned by local public health units. Can you tell us a little bit more about the prep work from Hamilton Public Health on this, and in terms of call centers or getting the message out to seniors in our communities?
Thanks very much, Nicole. So you're going to see more and more information from us this week in terms of our vaccination strategy and where we're going with this. And as we've been working with the province, as they've tried to sequence out who's going to have the vaccine, what the prioritization is, our strategy has actually shifted. We've got a whole suite of methods that are available to us, we've been working on, and then we're making choices based on what it is that the province is doing in terms of prioritization. So absolutely, when it comes to those who are over 80, we think there's a few different ways we need to approach that. One of those is through having larger scale clinics that are available to people who are able to get to them, but we want to be very mindful about mobility and ease of access to those sites. And at the same time, we know for that age group, this is a group we've been saying that you need to stay at home, you shouldn't be going out a lot, and they may well have additional problems when it comes to mobility. And so we're looking at some more specific mobile clinics that might be able to play a role in those settings. So we're moving forward with the very specifics around how that might roll out, and you'll see more of that as we go through this week.
And the health minister also says Ontario is expecting a shipment of more than 150,000 Pfizer doses tomorrow. How many will Hamilton receive?
Oh, geez, Nicole, in terms of the actual allocations, I don't have them at my fingertips in terms of the numbers. They're about the same size as our last ones, because now in the early days of this, they were targeting vaccine more towards the areas that were in the red, gray areas. So we were included in that. And now they are really striving to get vaccine out all across the province. And so as more and more communities are eligible to get vaccine, and now all of them are, that of course has been spread out over a larger group. So we're staying at about the same level of distribution. That's why I'm saying it's a fairly modest amount as we go forward. It's great news for the province as a whole. Or, whether you're living in a long-term care home here in Hamilton, or you're living in one in Sudbury or in Thunder Bay, you need that vaccine in order to stay safe. And they're making sure to get that in people's arms. But we'll have a modest amount as we go forward. We're expecting more towards the end of March, where we'll see greater volumes of vaccine.
Do you know if a modest amount means like 1,000, or how many is modest?
Let me say 5,000 to 6,000 dose range.
Okay, thank you so much.
Great, thank you, Dr. Richardson. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My first question is for Dr. Richardson. There is an outbreak at the Hamilton Wentworth Detention Center. Can you talk about, what help is being provided there, or what is being done to try and control the spread there?
Hi, Joanna. I don't actually have specifics on that one at my fingertips just now. My colleagues are working on that outbreak. So if you like, we can arrange to get back to you around that piece.
Okay, thank you so much. And the other thing I wanted to ask is, you had talked last week about perhaps there being further restrictions if you were still concerned with the, how much we opened up, or if there were gaps anywhere. Are you looking at any further restrictions now that you know where we've been placed?
Thanks, Joanna. And if you recall from my remarks earlier, I talked about the restrictions we'd actually put in place back in December that I'd put in place. Most of those are now well contained within the regulations, which is great news. So they're being applied everywhere. Things like the active screening in retail spaces, in workplaces. Many of those things, the posting of the information in terms of capacity reductions, and so I'm very pleased with the additional controls that were put right into the regulations. At this point, there's nothing specific for us to point to that is missing there. We have looked at bookings locally and how we might restrict those, but there's nothing in particular that we think needs to be added. But as always with our cases, we collect the information, we analyze it, we take a look at it, and if there's something more that comes out as a trend that we could do something more about, then we'll do that.
Great, thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So I will pass things back to you for some closing remarks.
Great, thank you very much, Jasmine, and thank you to our media partners for your questions. And we will be back here next Tuesday for another version of our media update. I want to thank Bill Custers and the entire team at Cable 14, as well as Clear Cable, who help us ensure these availabilities run smoothly, as they do each and every week. And for more information on COVID-19 and our response efforts, please visit our website at hamilton.ca/coronavirus. If you haven't done so already, you can further help limit the spread of COVID-19 by downloading the COVID Alert app on your smartphone or through the App Store at Google Play. we need to continue to work together to protect one another. And so please continue to vigilantly take hold of the measures that the doctor and Paul Johnson have elucidated today. Very important that we continue to do that, and that those levels of protection are still very critical to our keeping the case counts down in our community. So again, our next media briefing will be held on Tuesday, February 23rd, 4 p.m. Thank you for joining us today, and we'll see you next time.